Hello, welcome back. The topic today is food that can trigger the gastric ulcer problems. So, the previous videos we all know what is a gastric ulcer, stomach ulcer, peptic ulcer, duodenal ulcer, all comes on the same category. That is nothing but the breach in the lining epithelium. The stomach has a coating where it secretes acid and it has a coating protective layer. The protective layer is breached. So, when it's breached, the acid goes and attacks the wound. So the same example we can give. Suppose you have a cut in the hand. It's called ulcer in the hand. The same way there is a wound. There is a cut. But the problem, the difference is this ulcer or the wound inside. It's inside and it's bathed in the acid. So acid corrodes, causing pain, burning sensation, indigestion, all the bloated feel, all this can happen. So what are the other foods that can trigger? So mostly the ulcer happens because of the H. pylori infection or painkillers, especially drugs. So that is very important. So now these foods, they won't cause ulcer, but they can aggravate the problem. So what are that? Very simple, as I told you. Suppose you have ulcer and you have a hyperacidity, then you have to take medicines to reduce the secretion of the acid. But doctors will give some medication, especially PPI, proton pump inhibitors, that will reduce the acid secretion. The number two, what you can do is you can, instead of taking 3 meals, you can split into 6 meals, small quantities. Every 2 hours, have some bland diet. So when you take this every 2 hours, so there is always some food inside where the acid, instead of attacking the wound ulcer, it will attach the food, so it can reduce the pain and symptoms. This is number one. Number two, and of course, very importantly, you have to avoid smoking and alcohol. Smoking, suppose you have an ulcer here, smoking will prevent the wound healing. The same way, smoking, any tobacco, reduces the fibroblast formation, reducing the non-healing. It promotes the non-healing. The same way, alcohol. Suppose you have a cut here, you pour alcohol, it will burn. Same way, if you take alcohol, the wound will burn and it will not heal. Tea, coffee, milk. Very importantly, it should not be taken in empty stomach. Tea is nothing but tannic acid. Already the acid is there causing the problem. So if you take tea, the tannic acid will increase the problem. The same way, caffeine. Caffeine is one of the very important gastric irritant. So you have an ulcer wound, the coffee can trigger the pain or burning thing. The same way, milk is in fact it's a good thing. In fact, those days ice cold milk is given as a treatment, but very rarely it can. The acid and milk, the milk becomes stale and it becomes curd like thing and causing acid reflux. So this is better to avoid. And the other way, spicy food, oily spicy food. Suppose you have a fatty meal or oily food, fried items, especially fast food. So these are calorie rich. So digestion has a problem, as well as the oil and cheese. Main is there. You need more acid and more bile to digest those things. Suppose you have you have a ulcer wound. So more acid and more bile will aggravate the problem. The same way, suppose you take citrus, the fruits are really good, really healthy. But if you take something citrus like like orange, grapes, or even mango. Mango is the worst thing which can trigger the ulcer pain. And medications, especially painkillers, and certain medications we have to take, like diabetes medication, thyroid, they can also aggravate, but we cannot avoid, but at least better avoid the painkillers. So, and very importantly, stress. Stress is it could be in any form. It could be depression, it could be a financial stress, personal relationship stress. Lack of leads to lack of sleep, or the lack of sleep is very important, because only during sleep your acid level is very low. Suppose somebody is stressed and they're not sleeping properly, so the nocturnal acid secretion is too much, aggravating the problem. So if you have an ulcer, get a help of the doctor. They will do an endoscopy. They will look for what could be the reason for the ulcer and give you the medication. And medication has to be taken properly, the duration and dose. Thank you.